As a responsible pharmaceutical company, Mondi Pharma value our healthcare professionals as consultants, advisors, partners, and beloved peers. We know that you spend years and years investigating a lot of disease that no one can get, but anyone, young and old, is mad with common cold. Even Sir William Osler said the only way to treat common cold is to contempt it. But let's disagree with him. The way to treat common cold, as we learned from this pandemic, of washing hands, wearing face masks, cover cough and sneeze, and clean surfaces regularly. But would be great to find a hero who could help us from the start for common cold fight. Let's hear this story of this hero by our heroes. Allow me to welcome our interlocutor and advisor for our Doctor Talk Show today, Dr.Eslam Elbaroudy, his consultant pediatrician in Cairo University and Sheikh Khalifa Medical Center.
Thank you, Rudaina, for the nice introduction. And I'd like to thank all our great attendees for being with us tonight. Of course, also I'd like to thank Mondi Pharma for, as usual, the top-notch scientific activity and gathering. Today, we'll be hearing about a new hero for how to deal with the upper respiratory tract infection. But we're gonna hear about it, when to use it in what we call it a tipping point. What is meant by that? What's the tipping point? So for a tipping point, for you to know, it is a point or it is a moment where we could say that there is a social movement or a concept or even a medication. Even if it is small, it could do a great job. So when you are talking about a tipping point, you need to have an effect, which is our hero tonight. At the same time, you need a time frame to produce its effect. So the tipping point will spread virally. This is the effect that we're gonna see. Definitely today, we are fighting the viral spread. Allow me to introduce our great speaker tonight and to have a great discussion with Dr. Abdulrazak Juratli, that he's a consultant ENT in an NMC Royal Dubai.
Thank you very much for the great introduction. Thanks.
Thank you. It's our honor and a pleasure to have you with us, talking about something that it is usually of a great interest for, I think, most all of the attendees. Talking about the common cold, so we need to know what is the scientific definition for a common cold. And we need to know, is it something benign? What is the occurrence rate for this common cold in the community?
That's really a good question. Common cold are a group of viruses, and these group of viruses affect the upper respiratory tract. These viruses are pathogens. Now we need to distinguish between the pathogens viruses and the inhabited or human inhabited viruses. We have about 390 trillion of viruses inhabit the human body. So we are, if you want to count our body cells as a human, we have 30 trillion human body cells. If you count the bacterium which inhabits our body, they are 37 trillion bacteria. So what I want to say, our body is more viruses than human cells.
Yeah, this is called the microbiota. So that's viruses, bacteria, or even fungal.
That's it. So it's all actually, so but people, they don't have to be too much scared about it. But the pathogens viruses which affect the humans are 219 so far counted. 80% of them, we call it the group of common cold. And the common colds are the group mainly the rhinovirus and influenza, parainfluenza, respiratory syncytial viruses, and we have the coronavirus. We know about
of course.
All the and the adenovirus.
We are aware of that. Yeah.
So common cold viruses are mainly the capsulated group of viruses, and they actually make about 80% of the viruses which affect the upper respiratory tract. and all of them nearly capsulated with negative charge capsules, and that's advantages for us.
So, Dr. Joratli, I could say that the common cold, from the scientific point of view, that you need to have a pathogenic viral upper respiratory tract infection. How common they are?
They are pretty common, actually. We expect the adults to have these attacks with a frequency of 6 to 7 times a year minimally. And it could exceed this number, and in children it is higher. But the burden of these viruses on quality of life and the financial burden is quite huge. In the past, it calculated or counted about $40 billion of US dollar loss in the community a year. Nowadays, things improved, and the latest publication said about $25 billion of dollar a year.
It is decreasing.
The burden is not just from actually issuing the medicine for it, because it's not expensive, the medicine for the virus. It's the burden on the human himself. So they take time off work, and the time off work and the lengths of the infection.
So,
that's important.
I mean, okay, so regarding the occurrence, so now we are linking that also to the burden, or to the economic or the socio-economic burden. So how common, also to my understanding, and correct me if I'm wrong, so in the pediatric age group, I think that it is considered to be like 10 to 15% responsible for the deaths in the developing countries, for those who are below 5 years, as a complication for the common cold. So yes, this is my understanding, that it is really benign, but the complication, if we are not intervening as early as possible, maybe we will have like this huge, I mean quite huge number of morbidity or mortality. So this is something I think that maybe as a healthcare professional, I mean, we need to address as early as possible.
Yes, without any doubt. Patient comorbidity add more risk on that virus. Patient comorbidity could be, we know in pediatric and adult with some kind of celiac dysfunction or some kind of acquired immune deficiency. These actually also make patients more susceptible for getting more complication by getting the viral infection. That's why there are certain group of, as we both know, mainly the children and people who have COPD or something else, should have some vaccination for the some certain types of viruses to avoid them having the huge burden on their lifespan.
Yeah, the problem with the frequency, that a high frequency, even like one of my friends, just he's kidding me, and he's telling me that I could feel that it is one of my family members. So I have my wife, my kid, and even like my pets, and even that we have a common cold, that it is keep living with us. So this is, I mean, the understanding maybe with
Yes.
For the families. So hence, talking about the family, what is the perception? What do you feel? What is the perception of the family regarding the common cold?
Well, contagion is really important. When somebody in the family has the common cold, we expect the rest of the family to be affected. So everybody wants to protect himself from getting infected. So we would like definitely to develop something which protects the rest of the family and reduce the burden of it on on people who are in contact with the patient. That's why we would like patients to take time off work for 1 or 2 days minimally to avoid contaminating other friends and colleagues. But we can't avoid him contaminating his family. So we are in desperate need for some kind of medication which will stop the spread of the infection and eliminate the violence of the infection.
So what is the most common symptoms and signs that usually that it is like alerting for someone that starting, that this is the beginning of your common cold? What is the expected duration for the common cold? How to differentiate it with other common things that it is of a real medical importance?
Well, common things actually, common symptoms comes between viral upper respiratory tract infection, allergic respiratory tract infection, and bacterial upper respiratory tract infection. So that's how. So for me in my practice, when somebody comes to me with snotty nose and sore throat and little cough, a bit of temperature, a bit of lethargy, there's almost certainly viral infection. It's not bacterial infection. Bacterial is entirely different, and it's not allergic. Now, allergic rhinitis, for example, these symptoms, they do not have usually other systemic symptoms. It's just localized symptoms, merely in the nose. When I see somebody has allergic rhinitis, it's merely itchiness, sneezing, rhinorrhea, and itchy eyes. So without sore throat is very unlikely in allergic rhinitis. And it is most likely in the season, so patient knows about it. So history without temperature, doesn't have temperature, and there is no lethargy or weakness, and the symptoms longer in duration, and they are submitted to the exposure. Bacterial, we have to distinguish between sinusitis, bacterial sinusitis, and bacterial throat infection or pharyngitis. Now, they are a bit different. In throat infection, we have what it calls Centaur criteria. So if somebody comes to me with just sore throat and high temperature above 38 without cough, this most are likely to be viral and usually bacterial. So that's when I have to see the patient and interfere. It doesn't come with other symptoms. So that's the way how usually clinical things.
Just summarizing this, that the symptoms that usually that we are having for the common cold. So usually that you will have the runny nose, what we call it the cardinal symptoms, the runny nose, the headache, the posterior nasal discharge, or some sore throat. Sometimes that usually it is cough, but we would say that maybe that there is an annoying symptoms for anyone, which is the runny nose, the posterior nasal discharge. But later on you may have the cough. Maybe the duration is about like 10 days, but sometimes that it is prolonged. And as a healthcare provider, they supposed just like to differentiate with the severity, the direct onset of the symptom. Usually it is in the common cold, maybe it is gradual onset, different than the flu common cold, which is sometimes that it is abruptly starting, more severe body aches. Fever is more common.
It is different between the subtype of viruses and the host susceptibility, because if you are in a good strength, possibly the symptoms could come milder and last less longer than when you are really exhausted, tired, not sleeping well, not eating well. So the symptoms could last longer and get more severe as you presented: post-nasal discharge, itchiness, sneezing, rhinorrhea, nasal blockage. So that with a bit of lethargy and high temperature, usually we get some cough with it. Now, what I want to say, the burden of these symptoms are really remarkable on the patient himself and on the society. And you are absolutely correct. You know, something needs to be done for it. Now, I used to be asked a lot of questions. How will I be able to know that the virus hasn't been transformed to bacterial infection? And let us get
very important question usually.
Yeah. And some people, they say, actually, I'm a bit worried as a doctor. Let me give antibiotic just in case if the virus becomes bacteria, and the patient will not trust me, so I have to go and see somebody else because he didn't treat me correctly. The answer in a simple term: do not worry. If your diagnosis is accurate, the bacterial supernumerary infection on the top of the virus is very unlikely. Let's go to the statistical study, which was definitely approved. The possibility to have supernumerary infection on viral infection doesn't exceed something between 0.5 to 2%. And
so the point that it is mostly viral infection, and
Indeed.
with the expert physician, he would know, so or could differentiate that this is common cold, which is the common one. This is the flu common cold, this is the allergic rhinitis, this is the bacterial one. So from the start, he could start whatever is appropriate to treat. And there's no need, as we know, to start with an antibiotic as long as
Sure.
we know that this is a viral infection. And here's my question. So from your long experience, what do you think that it is the most commonly used medication prescriptions that usually you are seeing in your clinic, even if they are coming to you from other colleagues? What's the medication used by the colleagues or even by the parents themselves or the caregiver?
Now, the first line of treatment, actually, if it is virus, which is most likely, we give symptomatic relief. Simply.
Okay.
And symptomatic relief, we all know about it. It's paracetamol, prophen, or diclofenac sodium, depends on the situation, and ask people to wait and see, because this most likely...
So this is the first line.
The first line of
that
treatment.
usually everyone would do that, even like gargling or saline or some lozenges. Do you think that this is something good to be used or not?
Well, actually, let us rely on evidence-based. Now,
Okay.
if we
That's
want
good.
to tackle the virus, we have two modalities for tackling the virus, like any disease. One modality, systemic treatment, like when it is bacterial, we give antibiotic, which doesn't exist in our viruses. We have 219. There are 3 species of viruses, might have some oral antivirus, but this oral antivirus usually very limited and some side effects, and you have to make sure it's one of these 3 species out of 219.
So my understanding from what you are saying now, that we need something that really that needs to fight the viral infection, to stop progression of the symptoms and signs in the early period of having this the common cold or the viral upper respiratory tract infection.
Indeed, it's been studied, and the first line for defense mechanism is nasal cavity mucosa and the postnasal space and the oral, the pharynx. So most of the studies actually focus in trying to find a way of catching the virus before reaching its destiny and stop it of replicating and stop the propagation of the virus.
So good to know about something like that, and I could convey your message for our attendees today that we are in a bad need for a hero to stop the progression of the symptoms and signs for the common cold, to prevent the complication, especially for those who are having a vulnerability to develop a to be hospitalized, or to develop a complication, or to develop a flu symptoms. So just could you tell us how these viruses work, how it is penetrating our mucosa?
That's a really good question, and that's what all the study about, to find out the weak link for this virus and go to attack it before it starts its own implantation and replication. Let me give you an idea. Virus usually goes to the perception area, which is the receptors, and the main receptor for the viruses are in the postnasal space mucosa and the pharyngeal mucosa, but the first line goes through the nasal cavity. And there is something it calls attachment. It goes inside the cell. Inside the cell, we get replication. From replication, it goes to the blood. We call it viremia. Then the symptoms start. Now, when it is on the phase of implantation and replication, patients usually report little local symptoms as sore nose, sore throat, dry, unpleasant sensation, but no systemic symptoms. When it goes to viremia, then you get the high temperature, weakness, systemic manifestation, and start the nose getting the postnasal discharge, anterior discharge, blockage, and this sort of thing. So we need, actually, as you said, we need to find a way of stopping the virus of reaching its destiny.
So, Dr. Jaratli, are you aware of something, as we said, a hero that could stop the adherence, the penetration, the replication of these viruses in early stages of the common cold?
Well, there are a lot of publications about different products which could do the job, but we can't say unless if there is evidence-based. And to collect evidence-based, we need to go for the publications, and there is a systemic review just published in February this year about this particular subject, which is very interesting and very exciting. I'm sure you are aware of it.
So you are talking about the iota-carrageenan,
Indeed,
which,
yes.
which is my understanding that it is a natural ingredient that stick to the nasal mucosa and prevent the replication and the spread.
I started my talk about the common cold species, and I divided them into six big, large members. All of those members are capsulated. Now, these capsules actually, we have something it calls proteomic structures, and these proteomic structures are in the structure of the capsule, and we have a body cell proteomic structures, and those, when they adhere to each other, the replication, multiplication and propagation start. Now, what we want to stop this kind of mechanism of happening. We want to reduce the viral load inside the nasal cavity and stop the propagation and the multiplication of the virus.
Good.
Now, it's been approved. There is actually the natural product, as you've already started. It's a Red Sea weed product. It's been discovered a long time ago, not just recently. Used to be used as a high viscosity material, and it's highly safe as to save some kind of product for long-term saving of food. And it's been used in making medicine as well, as a saving product for the medicine, stop it from degradation. But now, the recent, or not recent study, they started in 2015, the first publication, talking about this particular material used as a nasal spray to stop, to adhere to the virus and stop the virus of getting to its target in the nasal and nasopharyngeal lining mucosa. Now, they studied it and they found that a sulfated, we call it, polysaccharide material consistency to this particular
Sulfated polysaccharide.
Polysaccharide.
This is the iota-carrageenan.
This is the iota-carrageenan, who has a positive charge, and this positive charge adheres because it has high viscosity to the capsulated viruses and stop it from replication and propagation. Now, this is in vitro, and
okay.
that was first publication in 2015. Then actually they did the study on the human, and they did a randomized meta-analysis study, which is high actual level of
meta-analysis,
efficacy.
definitely that, yeah.
And they confirmed that this is in human, works perfectly well.
Great. I mean, so the first study is talking about the in vitro, but now you are talking about an in vivo study.
Correct.
So on the human.
Correct.
Regarding the mechanism of action, isn't it?
Yeah, they studied the viral load, and they studied the duration of the symptoms and the severity of the symptoms in two separate samples. First sample, about 100 patients, they were given just normal saline, which is 5%.
Now we are talking about the efficacy. This is very great. I mean, talking about the efficacy, but to be honest, I was like very convinced with the mechanism of action. That's just, I want to recap it in my mind. So talking about iota-carrageenan, that it is doing like a protective layer in the nasal mucosa, then trapping the viruses, isn't it? So trapping the viruses, so hindering the spread. And this replicated viruses also could be demolished or stopped from being spread because of the negative charges that it is there in the nasal mucosa by that layer. And I read something that maybe I need you maybe just like to have a comment on it. So they said also that this layer of iota-carrageenan, that it is mimicking this glycan projection or receptors. So this would fool the viruses. So instead of penetrating it, so it is just sticking to that layer. So
yes, high viscosity, you are absolutely right. That's exactly the word. And it is gelatinic part. And that's why I said it used to be used in a conservative type of food, and it's FDA approved. But the concentration was really important because it has to be safe on the lining mucosa. And we have a little problem about the duration of the spray. When you put it inside your nose, how long is it going to stay? And that's not easy subject. So we were skeptical in the past, about the real efficacy for this medicine, because we know that the cilia beat of the nasal mucosa clears everything within 20 minutes. So how will we be able to use this medicine and confirm it's going to work? So, you know, we were too skeptical, but the publication is very clear that it
So now you are telling me that there was a publication that it is scientifically giving us the clues
Indeed.
about the efficacy of the iota carrageenan or the carrageenose. So just if you could elaborate a bit more about these studies, what they were tackling. So regarding all the symptoms that all of us we know about, the common cold, the duration, the severity of the symptoms and the signs, the complications.
Now, in a simple term, actually, they collected sample size, which is large enough to give the approve, and they gave him nasal spray, normal saline, which is 0.5%, instead of the iota carrageenan, and the same number of patients they gave him, which they have to be fitting to the same category of patients, adults and fit and healthy. They gave him the iota carrageenan.
So we are having in this study, we are having two groups. One is receiving the iota carrageenan or the carrageenose betadine cold defense nasal spray, and the other one is receiving the placebo. So what was the result?
Well, the result actually was very distinguishable. The duration of the symptoms reduced. So we used, for example, to take 4 days, it became 2 days. And the severity of the symptoms became a lot less. And even the relapsation time became remarkably less frequent in a way which is distinguishable and approved. So that's why actually now we don't have other choice apart from using it, because it does work. And reducing the burden for example, 50% from 4 days to 2 days, they make big difference in the quality of life, in the spreading of the disease, in the returning to work, in the financial burden, which usually society is suffering. So it does work, so that's a great achievement.
But the good thing about this scientific study that I have read about it, that it was decreasing the viral load. So they said for that group who received the iota carrageenan, I mean, it was reduced by 92%, a quite huge number. While those who are receiving the placebo, even it was not just only reduced, it was increased by about 600%. So do you think that this is something that really it is happening? Because it is a scientific study, and I was quite astonished about it.
The replication usually is huge for the virus. It's not just one-to-one. Soon after the virus sticks to the cell, the human cell, and goes inside the cell, the replication could produce thousands and millions of the copy. That's why actually the viral load is, we could talk about millions and millions reduction without any doubt. So that's why, because it stops that virus of adhering to the main receptors, it stops the virus of getting inside the main receptors, stops the virus of replication. So when the virus is not replicated, the number of viruses which usually affect our body are very little. And we always exposed to a lot of pathogenic viruses, but our body doesn't care about it. Immediately it gets rid of it without any concerns. We have a lot of self-defense mechanism, beautiful in the nose. We have a lot of hair inside the nose, and even the mucosa has cilia, and there is a bead, and there is a mucus blanket, and there's a local immunity. So body actually usually defend most of the viruses, but we are talking about the viruses with violency and with ability for penetrating the mucosa. Now, when you give a little help to the already existent body defense mechanism, you will make a big difference.
So this is a very distinguished criteria for the iota carrageenan. I mean, that stopping the sticking of the virus to the nasal mucosa and fighting the replication and the spread. This is very important. The other thing that you talk about it, the duration. Our understanding that regarding the duration, that usually for the flu or for the rhinoviruses, usually it is about 4 days. So the reduction, according to this study, was about 1.9 days.
Correct.
While for the coronavirus family, the reduction was about 3.9 days, an average of 2 days, which is quite a huge number, as you said. The symptoms also, the severity of the symptoms, because here also we need to distinguish between the severity of the disease and the severity of the symptom. The severity of the disease, it is about the complication.
Correct.
While severity of the symptoms and signs, also it was reduced by a huge number. It is about 35% or 40% for those who did not use the iota-carrageenan. Regarding the relapses, and the problem, as I told you, that the
comes back again.
My friend who told me that it is living with me in the family, so it keep coming to him, the relapses, and they said the relapses was decreased by 55%. This is something amazing.
That's the nature of the viruses in general. We have a problem with the viruses. They have many species, hundreds of species, and each one actually makes immunity for its just immune to the same species. And you could get another virus actually, as I said, the common cold are a list of viruses. So you could get infected, for example, with the rhinovirus to start with, and just shortly after you are recovered from rhinovirus, you get another species like influenza, parainfluenza, coronavirus, or adenovirus. So this is not going to hold immunity to the one which is coming actually shortly, and that's the problem. So why there is no immunity, and in country, it's not just less immunity. The body already exhausted from the first virus, and the perceiver are really exhausted and ready to perceive another virus if there is no immunity for it. So the best way, you are absolutely right, if you get some kind of product to stop all that actually first line mechanism and to help the first line mechanism and stop the virus of getting adherent.
So would you allow me to say that iota-carrageenan, so this carrageenose, the betadine cold defense, is having the new concept? So because usually we were scrambled when we were having just only one bug, we need to have one drug. But what is happening now, that it is one drug, but it could overcome or it could beat like many bugs.
Multi-species, you are right.
So
yes.
this is very important.
Yeah.
So we could understand that iota-carrageenan, it is doing the job. So first of all, there is a bad need. There is a bad need to have it initially in the early symptoms. But the other thing, when we are having, we know that it is really efficient. But my question, what about the safety?
Well, it's
very important, isn't it?
Yeah,
safety matters.
Yeah, without, it's FDA approved. Otherwise, we'll not use it. Now, the safety measurement is very strict, and it is standard in all the world. And if it's not approved, we can't use it. And that's what stopped us of using it a long time ago, because we didn't know the safest concentration. Now, in the concentration which this particular formula is made, it's 100% safe.
Dr. Joratli, so maybe all our attendees, they are curious to know what is the appropriate dose when they are using the betadine cold defense.
I like your question, appropriate dose. Now, what's been talked about from the company, can use one puff into each nostril 3 times a day. But to be honest, I don't take it.
Really?
No. I think, I put it in my pocket and I use it 2 puffs every few hours, depending on the environment. Because theoretically, as I say, if there's a virus in the surrounding structures, that's the time when we need to use it. So there is nothing regular in my actuality. If somebody is already affected working next to you in your office and you're worried about catching the virus, so you can use it 3-4 times a day. There is no risk on it. And
so just you can start to use it even without having like any initial symptoms.
To be honest, that's what I do, because it works. It helps the first line defense.
So we are catching Dr. Joratli now that we could use it.
yeah. I'm happy to use it. There is no, because it's absolutely safe. If you go to the mechanism of action, it is first of all red seaweeds, and it is
natural, locally working. So there is no any contraindication you are aware of?
Not at all. You can use it from age 1 year of age up to all the adults.
So from
of
age
life.
1?
Age 1. And it is safe for pregnant lady and lactated lady. So it is absolutely safe. There is no absorption rate, my friend. It works locally, and the digestion, there is nothing wrong with it because it's been taken in a higher concentration in other products, natural type of food over the counter, and there is no contraindications. The food confirmed absolutely safe as swallowing and digestion. Locally, it is safe. So my advice for people to keep it in their pocket and use it as a first line of treatment. So I use it when there is a virus at the start. So that's when you want to stop the multiplication and propagation of the virus. And in what I do in my practice, to be honest, because I do a lot of, I see a lot of patients with a snotty noses in my clinic. I just keep it on my side. I use it when somebody comes and sneezes in my clinic. I know I put the mask and everything, but it's still in the surroundings. So soon after somebody has really cold, comes to my clinic, just simply I just put 2 puffs into each nostril and pray for the virus not to adhere to my nasal lining mucosa and start producing symptoms.
Thank you so much, Dr. Joratli, for the very nice information, for the very helpful information, I think, for all our attendees to know about our new hero that we came to know about it in the common cold. And if you want to say anything for all our attendees.
Dr. Eslam, thank you very much for inviting me. It's my honor, actually, to talk about viruses and the way of attacking viruses.
The honor and the pleasure for us.
Thank you very much. Now, viruses are going to be a problem for the next generation, and we encourage any work which could halt the viruses from propagating or progressing inside the human bodies. We don't know what's coming in the future, but this product is really good at start, and we would like to expand our work and our experimental work to make it covering all the nasty viruses which are waiting until it attacks that human. And we are weak creature. We discovered recently very weak in front of the viruses. Future is promising. Any work which could help in halting the virus, to stop it of getting into the human body, is our big achievement to encourage and stop this happening. Thank you for attending this talk.
Thank you so much for all our attendees. Thank you for staying with us. I believe that all of us got a great information. Common cold is really common, and we have, as a healthcare provider, to stop it as early as possible. You know that there is much complication, there is morbidity, there is a mortality. But when you, as a healthcare professional, starting to hit that hard earlier, you can fight and you can stop whatever is happening. Today, we could understand that betadine cold defense is really performing a tipping point. By itself, it is an effect. The time frame is where or when that it is the early symptoms and signs for the common cold. So betadine defense, that it is a game changer in the common cold treatment. I hope that all of us could use it for all our beloved ones, not only our family members, but also our patients. They are the beloved person. Thank you so much, and see you soon.